Bone marrow as a regenerative agent has been used longer than pretty much any other agent. Back in the 80s and 90s, this was actually, bone marrow was used as a regenerative agent by a doctor named Hernegue in France to heal dying bone. So it's been around for a very long time. Currently, my processes for creating bone marrow concentrate is on its 9th iteration of how I take the bone marrow from a patient. I've taught a couple of dozen conferences on how to do bone marrow aspiration, and the last time I did a conference was admittedly about 3 years ago, and since that point in time I've had 3 new iterations of how I create bone marrow concentrate. Roughly in the laboratory environment, after you centrifuge something, it gets separated into different layers, and you can, if you understand how to process, you can use those different layers, acquire them, and put them together to acquire the greatest amount of cells with the least amount of irritants. Bone marrow is very effective for arthritis, for tendon tears, for ligaments. Needs to be kept away from nerves, and generally is not put into fascial planes. And this is all via hundreds of patients that I've treated over the last 11 years with bone marrow. One of the most common questions about bone marrow is, isn't that really scary and doesn't it hurt to take? I did a study 3 times on 100 people on doing bone marrow aspiration, and 95% of those individuals thought it hurt about as much or less than what they expected. There are 4 individuals, and I screen people for this, that can have more pain. These are individuals who have had significant injuries in the low back pelvis area, individuals who have had surgeries in the low back and pelvis, individuals who have had difficulty with needles in general. So I usually say, when I walk in the room and somebody hits the ceiling because I have a needle in my hand, those individuals are also prone to having a little bit more pain. So surgeries, injuries, previous procedures, and don't like needles. All those individuals are orally sedated before I do a bone marrow aspiration. And while we're processing it, they get to take a nap. Again, it's only about 5 to 7% of individuals that have difficulty with the bone marrow aspiration.